It is now my pleasure to present our next speaker of the afternoon, Eride Quarta. She's an assistant professor at the Food and Drug Department of the University of Parma in Italy. She has been naturally involved in the publication of many of the results of her research, and she's involved in patenting processes as well. But I would like to say that Eride won the IFOPS Women in Pharmaceutical Sciences Award in 2021, and also the Best Innovator of 2022 by the Italian Association of Women Inventors and Innovators. So congratulations for that. And her research interests are focused on solid dosage forms for controlled and site-specific drug delivery, with a special focus on biologics for pulmonary, nasal, and oral administration. So, Eride, thank you very much. And
thank you, Luana, for this kind introduction. And I would like to thank the DDL committee for offering me the opportunity to present my research work focused on a lung-to-heart nanomedicine for the chronic heart failure. The cardiovascular diseases are the leading cause of death worldwide, causing 18 million people deaths every year. So imagine for a moment to strongly open and close your hands. This is exactly what an healthy heart does, as it contracts and pumps the blood through the body, nourishing every cell and tissue. And then imagine at a certain point to lose the strength in your hands. So this is what happens in the patients affected from the heart failure with reduced ejection fraction. So the left ventricle is not able to pump the blood in the amount that the body needs. The symptoms are a large left ventricle volume, the thinned left ventricle walls, and a decreased systolic function, so resulting in a reduced left ventricle ejection fraction over than 40%. So currently, the clinical approach is based on targeting the renin-angiotensin-aldosterone system, and the drugs are administered mainly by intravenous and orally routes. So the aim of this work was to deliver the drug directly to the heart with a simple breath. The drug carriers were biocompatible and biodegradable calcium phosphate nanoparticles loaded with a therapeutic mimetic peptide. To avoid the risk of nanoparticle exhalation, the strategy was to embed these nanoparticles in a microparticulate powder that after the inhalation are deposited into the deep lung, in particular at the alveolar region, where the nanoparticles cross the blood barrier and following the blood flow through the pulmonary vein, they quickly reach the heart. Then the nanoparticles are captured by the cardiac tissue and the drug cargo is finally released to the cardiomyocyte, with the objective to restore the normal heart activity. Compared to the traditional administration routes, this project called Cupido aims to heart specificity with a lower drug dose and reduce the side effect, obtaining a more efficient and patient-friendly therapy. To prepare the mimetic peptide that drugs hepatitis nanoparticles, briefly, a calcium citrate solution is mixed with a phosphate solution in which the mimetic peptide is dissolved. And then the mix is being placed in a water bath at 37 degrees in order to destabilize the calcium citrate complex and allow the nanoparticles precipitation. So finally, the dispersion is dialyzed in order to purify the nanoparticles from the arachnid residual components. The mimetic peptide is a therapeutic substance that inhibits the intracytoplasmatic degradation of cardiac L-type calcium channel complex, increasing the contractility of the cardiomyocyte and thus restoring the normal heart activity. However, this mimetic peptide as it is not able to internalize the cardiomyocyte, and a carrier is needed. So the drugs hepatitis nanoparticles are a suitable carrier due to their negative surface charge that is highly compatible with the intrinsic charge of the polarized cells that are the cardiomyocyte, to promote the formation of the nanopores and enhance the cellular internalization. The nanoparticles were successfully produced at pilot scale levels with a rod shape and a zeta average of about 100 nanometers. So the highly negative surface charge suggests the good stability of this dispersion, and the mimetic peptide content was 7%. The calcium and phosphorus molar ratio was in agreement with those obtained typical from the hydroxyapatite nanoparticles. And the infrared spectroscopy analysis suggests the crystalline structure of these nanoparticles revealed by the splitting factor of 4. To prepare the microparticles embedding mimetic peptide nanoparticles by the bottom-up process, the spray drying technique, so the mannitol as water-soluble, inert, and safe adjuvant was selected in ratio 1:4 with the nanoparticles, fixed as the best candidate for the pilot-scale manufacturing at XEDE, the company in Belgium. During the pilot-scale production, the inlet temperature, atomization flow, and the feed rate were increased, and their influence evaluated on the critical quality attributes of the powder. In particular, in terms of mimetic peptide content that was enhanced, the residual water was kept constant in order to preserve the good product stability, and the median volume diameter was less than 3 microns, so suitable for the alveolar deposition. At the pilot scale level, the production rate obviously was increased from 1 to 60 grams per hour, with an yield of the process over the 90%. The obtained microparticles exhibited a spherical shape, with a rough surface due to the nanoparticles dispersed in the mannitol matrix on the microparticle surface. And when the SEM analysis was matched with the focused ion beam technique, allowed to highlight a very peculiar internal structure with a lot of small cavities organized in a reticular manner, like a grid. This novel structure is clearly due to the mimetic peptide, since was not evidence in the unloaded microparticles, and this increased the porosity of these particles. So this is one of the main parameters determining the aerodynamic behavior. Namely, when the powder was loaded in Nemera, a medium resistance inhaler device, it was realized at a flow rate of 65 liters per minute. The powder was successfully emitted, mainly deposited between the stage 3rd and 4th of the NGI, and the fine particle fraction peaked to 70%, with an extra fine particle fraction slightly less than 50. Finally, the mimetic peptide release from the inhalable microparticles in stimulated lung fluid was assessed and reflects two different conditions. So the first, of the 15% of the total amount of the mimetic peptide that is very fast released, and this is non-encapsulated, maybe it could be dispersed in the microparticle structure. And then the remaining 85% that is slowly released under controlled kinetics mediated by the nanoparticles dissolution, since the hydroxyapatite dissolved at pH less than 5. Then, the final powder was tested in porcine model of heart failure with reduced ejection fraction from 60 to 20% induced via tachypacing. And the healthy pigs were involved in this study as control. So the therapeutic effect was assessed by echocardiography and telemetry system as non-invasive method. So after the 2 weeks of daily inhalation, really the animals inhaled 7 milligrams per kilos per day of microparticles consisting of 15 micrograms of mimetic peptide for 14 minutes at a flow rate of 10 liters per minute through a customized mask. So at the end of the study, the animals that inhaled only the vehicle, the unloaded microparticles, progressively deteriorated the left ventricle function in terms of thin walls, enlarged left ventricle volume, and reduced the ejection fraction over than 40%. On the other hand, when the animal inhaled the mimetic peptide microparticles loaded with the mimetic peptide, the ejection fraction was totally recovered as the baseline to 60%. And the improvement was already evident after 1 week of the treatment. In detail, the delta ejection fraction was increased between the animal treated with unloaded in gray and loaded in green nanoparticles, statistically significant, over than 30%. So at the end of the study protocol, the animals were intubated and sedated for the in vivo catheterization and for the invasive hemodynamic studies. So the animals that inhaled the mimetic peptide microparticles attenuates the pacing-induced enlargement of the left ventricle size, improving the systolic function. And in line with these results, also the myocardial contractility was restored, as you can see by the higher slope of the end-systolic pressure-volume relationship of the animal treated with the loaded microparticles that was very similar to those of the healthy pigs. So to further confirm the beneficial effect of this mimetic peptide formulation, the histological analysis of the left ventricular myocardial biopsies suggests that the interstitial fibrosis was reduced in the animal treated with the mimetic peptide, in agreement also with the left ventricle collagen volume fraction of the pigs treated with the mimetic peptide, very close to the percentage of fibrosis of the healthy pigs. And finally, the transmission electromicroscopy images of the cardiomyocytes suggest that there were no statistically significant volume shift between the subcellular compartment of the cardiomyocytes, so suggesting that del-type calcium channel complex density was totally recovered due to the mimetic peptide therapeutic effect. So to conclude, the proposed lung-to-heart mimetic peptide microparticles in nanoparticles in microparticles loaded with the mimetic peptide is the first therapy that addressed the molecular causes of this pathology, the heart failure with reduced ejection fraction, and not only the symptoms like the currently treatment. So this could be a novel platform for an on-demand delivery of a wide range of peptide and RNA-based therapeutics for the disease, the heart. So I would like also to add that very recently a spin-off of the CNRE in Italy, founded by some of the members of this Cupido project consortium, was supported by a venture capital for the clinical translation of this technology, and the pharmacokinetics and the pharmacodynamics studies are still ongoing. So I would like to thank all my Cupido partners for more than 12 countries from Europe for the great effort involved in this challenging project, and in particular, so my research team from the University of Parma, led by Francesca Buttini. And so thank you for joining my presentation, and I'm glad to answer your questions.